Good afternoon. Welcome to the Department of Behavioral Health Weekly Update. I apologize for the slight delay today. Some technical difficulties on my part. Okay. All right. October is LGBTQ plus History Month. So keep a close eye on your inbox and look at some activities that we have planned in honor of that. Continuing activities for National Latino Hispanic Heritage Month, and you can also see on our website and in your inbox some activities associated with that. Straight to the numbers. Worldwide, we now have 236,656,000 cases of COVID and over 4.8 million deaths. In the United States, over 44,129,000 cases, and now over 708,000 deaths, almost 709,000 deaths. In the state of California, we've stayed steady at a 2.6 positivity rate. That is unchanged from last week. In Fresno, our cases have slowed down. We're at 130,074 cases, but we have exceeded now 2,000 deaths. We have 2,008 deaths. You'll see on this slide that you are seeing an increase in that curve in the lower right graph. In terms of youth, our cases, we're up to 26,700 cases in the last month, or total confirmed youth cases, my apology, 26,700. And in terms of hospitalization, we came down a lot, and then we're just kind of hovering here. So we're at 284 compared to 296 last week, 62 in the ICU, which is the exact same as last week, and a few less ICU beds, likely because people still are getting sick and having accidents and requiring the ICU for other reasons. It's a busy time. We'll talk in a minute about flu vaccine. We are seeing cases of flu, and that does sometimes result in people being hospitalized. So just like last year when we had flu season and a COVID surge, it can be a really, really challenging time. Youth hospitalization, you see a slight uptick. The ICU stays down, but same as adult, just hasn't really dropped significantly. In terms of testing trends, we're now down to 7.7% positivity rate, which is a little better than last week, but still not where we need to be. We are now at 1.12 million doses of vaccine provided. Boy, I'd like to see residents fully vaccinated over 500,000, but we are just creeping up on it. Lots of booster shots being given, not as many first dose vaccines being given. With the vaccine mandate deadline being last week for healthcare, we did see a little uptick of new vaccine doses being given, but we still have 90,000 partially vaccinated. So if we can get all of those fully vaccinated, we'll easily exceed that 500,000. For youth, we now have 36,521 youth fully vaccinated and another 43,000 with at least one dose. So that continues to move along as well. In terms of what's happening in Fresno County, and I have some other slides later, our case rate is going down, still not quite where California is, but continuing to drop. And we should see with that drop eventually a drop in hospitalizations, but it will take a while for deaths to drop. Remember, all of those things lag behind one another. A little bit more in terms of positivity of counties in the red zone. We are now in the red zone for positivity, but not for case rate. And so way too much purple on this slide. I love the color purple, not for this. All right, and in terms of what's happening in Fresno County, as I stated, we are continuing to see cases decline. Hospitalizations are dropping dramatically, but have leveled off a bit, and deaths increasing. Positivity rate, again, is slowly decreasing. We have had our public health officer issue a flu vaccine mandate for healthcare providers. I will tell you, I got my flu vaccine on Sunday, and I highly encourage all of you to get your flu vaccine before you get a notice telling you that you have to. All right. New cases continue to decline in California. They're actually lower than the county of Fresno. Same positivity rate as we said, slower decline in hospitalization, just like in Fresno County. I did want to share this, though. In California, they looked at from September 19th to September 25th of 2021, and unvaccinated people were 7.1 times more likely to get COVID than fully vaccinated. So they looked at every single person who reported a positive COVID test and if they were vaccinated or unvaccinated. So by far, a lot more people who are unvaccinated are getting COVID. You see that slight decline, and that really is a reflection of if there's less COVID in the community, no one's getting it as much, but unvaccinated people are definitely getting it more. In terms of deaths, it's even higher. 17.4 times more likely to die of COVID if you are unvaccinated. As we've talked about previously, if you're vaccinated, you still could get COVID, you still could die of COVID, but the risk, the chance, the odds are much worse if you're unvaccinated. Again, as we've talked about in terms of the risk that you're willing to take, you have to say, well, if I'm vaccinated, I have a 7-time less likely risk of getting COVID and 17.4 times less likely risk of actually dying of COVID. Weigh the odds, make a good choice. Okay. Cases continue to trend down nationally. They've actually declined by about 35% since September 1st. We still do have parts of the country. We talked about Alaska being the worst state in the nation right now. They have had to implement crisis standards of care in some parts of Alaska. Truly excruciating for healthcare providers to have to ration care this way. Hopefully they will emerge from their surge soon. They have a pretty low vaccination rate, and they also have fewer resources per capita than other parts of the nation. That's a really bad combination. When people choose to be unvaccinated and they don't have healthcare resources, they're actually having to choose who gets critical care and who does not. It was announced this week that Merck has completed a trial of a new antiviral pill. Ooh, I always get asked about treatment for COVID, and this is a pretty exciting development. It is just finishing the trial, so as per every other medication or treatment, such as vaccines, it does have to go through an approval process. But there's a lot of high hopes around this antiviral flu. It's very similar in nature to, you might have heard of Tamiflu. And Tamiflu is an antiviral that's given when people have influenza. So this would be an antiviral. It's not a monoclonal antibody. It's an antiviral that's given when someone shows some symptoms. And the really important thing is it's a pill. So it's something that people could take home with them and take it at home. Unlike the monoclonal antibodies, which have to be either injected or IV, and so a much more labor-intensive, more difficult. You got to go to a doctor's office. It's a pretty big deal. And hard to, get people to do that when they're sick at home versus, have a pill prescribed and be able to take it at home. So that's pretty exciting. The FDA is planning to discuss Pfizer shots for children aged 5 to 11 and booster shots for Moderna and Johnson & Johnson later this month. So hopefully by the end of October, we'll have some decisions made for those two population around Pfizer and Moderna and Johnson & Johnson. And then I just wanted to mention, this is a really sad statistic, over 120,000 American children, many, many more throughout the world, but over 120,000 have lost a parent or a caregiver to COVID during the pandemic. And a lot of times we think about the people who died or the people who got sick and hospitalized, but we don't always think about the families who are left behind. Recently, there's been stories in the news about families of 4 and 5 kids who lost both parents to COVID, really just terrible tragedies, and why we really focus on community benefits that the vaccine brings. Your taking the vaccine may not help you in the way you're thinking. Maybe if you got COVID, you wouldn't get that sick. But if you take the vaccine and now you're not spreading COVID to the same degree you would otherwise, maybe you're saving someone else's parent. So think about that. Fresno trends. This information came out this week as well, and I just wanted to share it with you. We have had one death under the age of 19 from COVID, so not a lot. And I've often heard people say, well, so few kids have died. Why do we worry about kids wearing masks? Why do we worry about kids getting vaccinated? Well, those kids have parents, and those kids have grandparents, and those kids have neighbors, and they have teachers. And, you know, I don't know about you, but when my kids were in daycare or school, they came home with all kinds of viruses and illnesses and colds and such, and they gave it to every single person in our family. And COVID's the same way. If we don't put those protections in place, then that's what we should expect, that the kids will get sick with COVID and they will spread it amongst their families. And some of their family members will be hospitalized and some will die, so that's why. 9 deaths between the ages of 20 and 29, and then it just goes up. And so but we have of note had over 100 deaths between the ages of 40 and 49 and over 200 between the ages of 50 and 59. And so in terms of females, 7% of the deaths have been under 50, male 9.7. So more risky if you're male in that regard. And then by race and ethnicity, you can see the numbers on the left-hand side for Asian, Black, Hispanic, white, and other. And so that is 179 individuals of Asian descent have died, 81 who are Black, 1,000 who are Hispanic or identify as Hispanic, and 606 who are white, and 98 of other. The important thing, though, on the right-hand side, because we've had such a large Hispanic population, is you look at the total Fresno County population. The blue is Hispanic, and the gray is non-Hispanic, and then you see the deaths as well. So a really high number of deaths. All right, that is my update today, and so I'm going to turn and see if we have any questions or any questions through chat. Okay, can the PowerPoint be emailed to us? Absolutely, happy to email the PowerPoint to you. Tina, I think, responded in chat, or I'm sorry, I'm sure it was Brian that responded in chat to let you know that we're happy to share that PowerPoint. What is the breakdown between unvaccinated and those with natural immunity? Research is showing that those who were unfortunate enough to get the virus are as safe or safer than those with the vaccine. When will that be addressed? That's a great point. One thing I'm going to mention is that later this month, we're going to replace this weekly update with an all-staff meeting. It's been a few months since we had our all-staff meeting. We want to focus on some things besides COVID. But I have asked Dr. Reyes Vora, the public health officer, to come to that meeting and be available to answer questions about COVID. Reyes is a physician, an emergency physician, a toxicologist, and the public health officer for Fresno County. He is a wealth of information, and I think he can answer some of these questions. I actually heard him answer this very specific question in a media call last week, and I will somewhat telegraph what I think he will say when this question gets asked. And I've talked about this before too. Most definitely, having had COVID does afford you some immunity. Studies have shown that you get a boost in your immunity when you get the vaccine. There are no studies showing that you have more immunity through having COVID than through the vaccine. And in fact, there are some studies, I believe, that have shown you have more immunity through the vaccine than natural immunity. There's a lot of variability in natural immunity. And so one person might have a great degree of natural immunity and others not so much. And so to rely on natural immunity, in my opinion, is just a risk, and you have to decide what risk you're willing to take. But the most important thing, and we've talked about this before, is to get natural immunity, you have to get COVID. So what you're doing is you're comparing the risks of getting COVID in order to get the natural immunity that comes from getting COVID, but you have to accept the risks that come with getting COVID. And we just talked about it. If you're unvaccinated, you're much higher hospitalizations. That natural immunity, you don't earn it until you survive COVID. So if you're unvaccinated, you still run the risk of 7 times more likely to go to the hospital and 17 more times more likely to die. If you survive with those odds, you will have natural immunity that might protect you as well as a vaccine. But you have to take that risk of hospitalization, dying, or, I have friends and family members who've gotten COVID, not hospitalized, and still have issues months later. Maybe they've lost their taste of sense and smell. Maybe they have a brain fog. Those are just risks you have to weigh. If you believe that natural immunity is a risk you're willing to take, then take the risk of getting COVID, being hospitalized, and dying, which is significantly higher if you're unvaccinated. And then you compare that to the risks of having the vaccine. Now, billions of people have gotten the vaccine. And so we do know what the risks are with the vaccine. In terms of what are the risks of the long-term risks of the vaccine, well, I would just offer to you, what are the long-term risks of having COVID? Because even people who don't get hospitalized with COVID, even people who don't die of COVID, could also have long-term risks that we don't know. We will not know what those risks are until 10, 20 years have passed. So it's all a risk calculation. And you just have to take the facts that are available and make the best decision for you. Okay. When you get smallpox, etc., you do not get vaccinated. Millions have already had COVID. Looks like the same person is just very persistent in believing that natural immunity is the way to go. And again, I've answered this as best I can. What I would recommend is that we talk to Dr. Bora when he comes. Every virus is different. There are some viruses that you get once and you never get them again. And there are some vaccines you need once and you never need another vaccine. But every virus is a little different. When you have a pandemic, you have viruses that have a much greater likelihood of evolving and changing and develop variants that may be resistant to natural immunity and to vaccination. And so those are all, again, variables that have to be considered. You can't necessarily compare one virus to another in terms of what's best in this situation. Okay. All right, what is the current DBH vaccination rate and for Hawk? The vaccination rate for DBH, I don't know if Helen's watching. I think I shared this previously. When we first were notified of the mandate and began asking what the vaccination rate was, it was about 82%. And eventually it got to be much higher. So probably at this point, I would say less than 10% of our staff remain unvaccinated and would have some sort of exemption in order to test, or they are on an unpaid leave right now. So that's really where we're at. Okay. I don't know if there's any other questions. I don't see any on the chat. I don't have any via text. So I will tell you to have a great weekend, stay safe, go to the fair, stay outdoors. Hopefully our air stays a little clearer. The smoke has been just awful. I definitely have appreciated having this mask outside even with the smoke. And so we'll see you next week.